oral anti-diabetic agents. They can be grouped into about 9 classes, and for each of these classes, we have what are known as biguanides. In the biguanides, also have Incretin analogues, DPP4 inhibitors, alpha glucosidase inhibitors, sodium glucose cotransporter 2 inhibitors, the Glinides, the Thiazolidinediones, sulfonylureas, as well as Amylin analogues. So the biguanides, this involves metformin, and the mechanism of action of metformin is inhibiting gluconeogenesis in the liver, as well as increasing insulin sensitivity by stimulating the PPAR gamma receptor stimulation in the peripheral tissues. Then we also have Incretin analogues such as exenatide and litaglutide. So Incretin is a hormone. Incretin is a hormone which actually promotes the secretion of glucagon-like peptide, as well as GIP, and these two hormones have a insulin secretagogue effect. So if incretin is increased, the production of insulin is also enhanced. So incretin stimulates the incretin analogues. These are drugs that look like incretin, and they will actually be able to stimulate the production of GLP and GIP, which will result in increased insulin secretion. Then we also have the DPP4 inhibitors. So DPP4, this is the enzyme that is responsible for breaking down incretin. So DPP4 catalyzes incretin, and if DPP4 is inhibited, it means we are going to have a long half-life for incretin, and there will be more production of GLP and GIP, which actually leads to increased insulin secretion ultimately. The other type of oral antidiabetics is alpha glucosidase inhibitors, such as acarbose and milglitol. And these drugs inhibit the breakdown of sugars and the absorption of glucose in the intestine. Sodium glucose cotransporter 2 inhibitors, such as canagliflozin. These drugs inhibit reuptake of glucose in the renal tubules by blocking the sodium glucose cotransporter 2 channel, and this will increase there will be a glycosuric effect, so there will be more glucose in urine. And these drugs, they are very useful, especially in patients that have cardiac conditions. But the adverse effect of these drugs is that with the glycosuria, there's increased tendency to develop urinary tract infection, and sometimes these patients can actually develop venous gangrene. Then we have the Glinides. These are drugs that act by blocking. So there are potassium channels that are at the surface of beta cells in the pancreas, and these ATP-dependent potassium channels are responsible for the movement of potassium out of the cells. And if potassium is moving out of the cells, it means the cells will actually repolarize if they are losing potassium. But if this channel is blocked, it means potassium will build up in the cell, and this will lead to depolarization of the cell. And when the cell depolarizes, the voltage-gated calcium channels will then open, and when these voltage-gated calcium channels open, they will help to have more insulin secreted. So this will have a insulin secretagogue effect. We also have drugs such as Thiazolidinediones, and these drugs stimulate peroxisomal proliferative activator receptor gamma, and this is a receptor that increases insulin sensitivity. So these drugs, pioglitazone and rosiglitazone, increase insulin sensitivity. Okay, we have sulfonylureas. Sulfonylureas have a similar mechanism to the Glinides. So the glibepride and glibenclamide, they block the ATP-dependent potassium channels, leading to depolarization of the cells and increased insulin production. Then amylin analogues, these are drugs that reduce the breakdown of sugar in the gut. They increase the stay of sugars in the gut, of glucose in the gut, and this has a protective effect and reducing glucose absorption. So those are basically the main mechanisms of the oral antidiabetics. Note there are about 9 mechanisms, or we can just classify them into 8 mechanisms and define them with what is known as the omnious octet, with 8 mechanisms of oral antidiabetic mechanism. You can look up another video on omnious octet, where it will be just explaining the 8 fundamental mechanisms by which oral antidiabetic medications work. Thank you.